There are few guidelines. So one is the ADA guidelines from 2026. Those guidelines are published every year, and the new guidelines are going to come out. The 2027 guidelines will come out sometime this year, later this year. I'll talk very little bit about a systematic review of practice guidelines. So this paper looked at 10 recently published guidelines on inpatient management of diabetes. And a lot of the things that everybody mentioned, all about from how to manage patients when they're admitted to the hospital, what to do when they leave the hospital, all those things are covered. And then if you want some specific things, so hyperglycemic crises, so if you want something on DKA or HHS, there's a specific consensus report from the ADA and the European Association for the Study of Diabetes. And then there are some other specific ones on hypoglycemia from the Endocrine Society for Clinical Practice. This is 2023 guidelines. Hyperglycemia, again, from Endocrine Society. But I think one thing that stands out from all of this is most of the data and information for ward patients, general medical patients, is coming from ICU patients. We still don't have very good evidence from medical ward patients or even patients in the surgical service that are being managed on the ward. A lot of it is coming from the ICU. Very recently, last year, and I'll talk about this tomorrow, there's a new paper, smaller study, but it's come out, and that's based on ward patients. But that's definitely an area we need to highlight, even in our guidelines, that we need more evidence for management of hyperglycemia and diabetes for ward patients. I also want to just talk about this one. I'm not going to go into all of it. So this is a systematic review. So they reviewed 10 guidelines, and these are global guidelines. And I'll talk about them more tomorrow. And they looked at the things from the ADA, Society of Hospital Medicine in the US. They looked at Canadian guidelines, Australian guidelines. And so these are 10 practice guidelines. And they reviewed the quality of these guidelines. Only 5 of them were high quality. So we have only 5 high quality guidelines globally. And they saw there was a lot of disagreement on the blood glucose targets. We still don't have agreement on what the blood glucose target should be for patients on the ward. So yes, we can talk about education, we can talk about teaching PGs and nurses, but we actually don't even know what the correct target is. And we don't have any research around that. How to manage patients in the hospital when it comes to home medications. Should we continue home medications? Should we stop home medications? Again, we don't have good evidence. Everyone does things differently. Even in my hospital, people do things differently. Some stop certain things, they start certain things, they put them on insulin for a few days. So there's a lot of variability. And then one area where there is very little data is how to transition. And a few people mentioned that. How do you transition patients from the hospital to home? Do you start their home medications 1 or 2 days before discharge? Or do you discharge them and tell them when you go home, you can start taking your home medications? How do they transition from insulin to back to oral medications? If you have changed their insulin regimen, if it's more complex, how do we transition patients? There's no agreement in the guidelines. People also mention when should you follow up? There's no agreement. Who should you follow up with? Should you follow up with a family doctor, endocrinologist, diabetologist? When should you follow up? What should you talk about? There's no agreement on guidelines, even in the high quality guidelines. And we'll talk more about those tomorrow. So I think overall, we can review the guidelines, but I think the answer is going to be we don't know, even from the guidelines. So I think as a group, the challenge for us is going to be what the current guidelines say, see what makes sense for an Indian context and try and provide the best recommendations. And I think importantly, if we can highlight all the areas where we don't know and don't have knowledge, I think that would be good for further research. So Dr. O, maybe I'll stop here and then we can have more discussion later.